One of the protective factors is having a good sounding board. And so I always say you vent 3 times to 3 different people and then you move on. And if
Hmm.
you don't feel like you can move on, like you still feel this knee jerk reaction to tell the narrative again, you probably vented to the wrong people. So I don't like us to vent to family members. They seem to be
Hmm.
biased. I don't know if you know that, but nothing that I do would ever make my siblings say that I'm the worst, right?
Right, right.
So a mentor is the best person to vent to because that's someone that you can vent up to. They've typically been where you have been or have some relation and could really be a listener.
Welcome to Student Affairs Now, the online learning community for student affairs educators. I'm your host, Rochelle Pope. Today we're exploring a topic that is increasingly urgent, often misunderstood, and let's be honest, deeply felt by many of us in this work. I'm talking about vicarious trauma. Our guest today, Dr. Jill Bassett-Cameron, is here to help us understand what vicarious trauma is and what it isn't, and why it demands more than a yoga class and a scented candle. We're going to unpack the myths, dig into the research, and talk about what a more sustainable, trauma-informed student affairs practice can look like. Student Affairs Now is the premier podcast and online learning community for thousands of us who work in, think about, and support the field of student affairs. Our mission is to make student affairs more accessible by bringing timely, relevant conversations to higher education professionals in a way that's informative, engaging, and community-centered. We release new episodes every week on Wednesdays. Find details about this episode or browse our archives at studentaffairsnow.com. Today's episode is sponsored by Evolve. Evolve helps senior leaders release fear, gain courage, and take action for transformational leadership through a personalized, cohort-based virtual learning experience. As I mentioned, I'm your host, Rochelle Pope. My pronouns are she and her, and I'm a professor in the Higher Education and Student Affairs program at the University of Buffalo. I'm recording today near the University of Buffalo's campus on the unceded land of the Haudenosaunee people. Dr. Jill Bassett-Cameron is the Senior Equity and Inclusion Officer and Title IX Coordinator at Central Connecticut State University. Since 2019, her workshop, Understanding Your Vicarious Trauma, has reached hundreds of practitioners. Her writing has been featured in About Campus, Akuhau Eyes Talking Stick, and the NEC Journal of Applied Educational Research. She also hosts Spill the Beans with Dr. Jill, a YouTube series bringing her research into lively, accessible dialogue. Jill, welcome to Student Affairs Now. We are
Thank
so
you.
glad you're here. We
Thank
are
you for having
thrilled.
me.
Hey, what else would you like us to know about you before we start this conversation?
Sure. So I'm a mother of 2 toddlers, so I'm a
Oh,
little
you're busy.
busy. My husband is also in higher ed. He's actually the director of student conduct at a sister school and originally from Jamaica.
Ah,
So our home here, where I'm recording from, is the Iroquois tribe. So we had our house blessed when we purchased it, and we get to hear Native American drumming every spring to kick off the year. So that's a wonderful part of our home here. I have a senior dog named Jasper. He's very sweet. Been in higher ed for a long time, about 2 decades or so, and I've been in the Title IX area and really just love to give back to higher ed as much as I can. I think that's because I'm one of 5 children, and so I'm used to like sharing, right? But
right.
I'm also a Leo, and it's Leo season, so I thought that this would be a great opportunity to share some nuances with our colleagues.
Oh, that's great. That's great, Jill. Thanks. And
Yeah.
loving hearing about your family and how this all connects for you.
Yeah.
So let's get into this. What exactly is vicarious trauma? I hadn't heard the term before I started um, talking with you and checking out some of your YouTube stuff. How does it differ from burnout and compassion fatigue that we hear a lot of? So, what is vicarious trauma?
It's such a good question, and a lot of people get it very confused. So, one of the things I like to do in my workshops or talk about the vocab and the terminology. So, vicarious trauma is going to be what happens to the helper when they hear the trauma from another source. And
Hmm.
it's going to be neurological, cognitive, physical, emotional, spiritual, and physical, right? So it's all encompassing into the holistic person. The other thing that I would explain is that it's a pendulum. So if you think about burnout is the worst of the worst, the opposite of that is called compassion satisfaction. So essentially, compassion satisfaction is the pleasure that we get from the job that we do.
Hmm.
So that's a pendulum. Halfway through is going to be vicarious trauma, and that's going to be the lived experience. When you go from vicarious trauma over to burnout, that's leaning more into the compassion fatigue. And
I
so
see.
vicarious trauma is like the step before compassion fatigue that leads to burnout.
Right. So, but what you're talking about is we're listening to the stories of our students, of our colleagues. We're seeing something that's happening on campus that for someone else has been pretty traumatic.
Hmm.
It's shaping them. And so we're not just hearing the stories, we're taking all of that in. And in
Correct.
some of those cases, then we are on that pendulum that you were talking about. The the experience of compassion, the being satisfied and moving all the way to, to the burnout. But there are
Right.
some steps before burnout. And if I'm hearing you correctly, if we're smart, if we're wise, if our campuses are helping us, we don't
Hmm.
have to get to the burnout
Exactly. And we
component.
cost the institutions, the business money when we have staff turnover. So
Right.
one of my pitches to stakeholders is, well, I can either get in there now or give literature and give support, or when you have staff turnover, you're going to have to re-enroll everyone, right? And teach all
Right.
the things of how to do the job versus nurturing the ones doing the job.
Right. Yeah. So, why is it a problem when people start confusing vicarious trauma with just what we're hearing for self-care? Now, I don't really want to, I mean, I know I made a little comment early on about scented candles and all,
Yeah.
about this, but I think we underplay what self-care really means. And so, why is it talk to us about this
Yeah.
problem between confusing vicarious trauma with self-care needs?
So the analogy that I like to give is vicarious trauma is like the cavity. Okay. Self care is you brushing your teeth.
Got it.
Everyone needs to
Great.
brush their teeth, regardless if they have a cavity.
Right,
Okay. Because I have cavities, I might brush my teeth more often.
right,
So because I have vicarious trauma, I might want to do more self care.
right,
But brushing the teeth is only going to aid in the cavity prevention, but not necessarily like everyone needs to brush their teeth. Everyone needs self care, period. And then
right.
vicarious trauma might be the byproduct of what we do for a living.
Yeah, right. I think that's really an apt analogy too, that, we can think about it that way. And it's not to put down the fact that we need a massage or scented candles or just spend some time away from work, but that's not going to solve our problems. It's not
Exactly.
going to address the issues of vicarious trauma.
Yeah, and I would even take it one step further that in speaking with dental hygienists, some people are more prone to cavities than others. I've
Right,
actually never had a cavity in my life, and I've had more tartar. And so some people who experience PTSD, for example, might be more accept to the vicarious trauma because they had their own lived experience. So
right,
that's what I would call the unicorn. When you yourself have experienced the trauma, but then you're helping someone through that same trauma, that's a unicorn experience.
right. Okay. Yeah, that makes a lot of sense in that why two of us can hear the same story, help
Hmm.
a student or a colleague through the same issue, but one of us is affected differently than the
Correct.
other. Sure. Okay.
Yeah.
So, what does vicarious trauma look like in everyday student affairs work?
Yeah, so I mean, we're going to absorb it from, the disclosures from any kind of trauma, but it's also not like large traumas. And
Mhm.
so a lot of the colleagues that we work with have putting out fires every day.
Mhm.
It doesn't need to be the worst of the worst scenario, right? It doesn't
Mhm.
need to be a suicide, a gesture of self-harm, it doesn't need to be huge. It can be small because it's really about how the practitioner experiences that, right?
Hmm.
I mean, I'm sure you and I have both have stories of cases that roommate conflicts can take, 5 hours to 5 days to five
Hmm.
months, right? And so it's not so much about the grandiosity of the incident as so much as what the practitioner is giving and the amount of bandwidth.
Hmm.
And what that will look like in our colleagues is called indicators of vicarious trauma. PTSD is a medical diagnosis, so they have symptoms.
Hmm.
Vicarious trauma is not a diagnosis, it's an experience of life. And so
Hmm.
no one can deny that you have vicarious trauma, but you also can't like fall ill from vicarious trauma. So the
Right.
indicators might be anything from anger to cynicism to sadness to anxiety. I have colleagues who have nightmares, overeating, undereating, stress, hypervigilance, disengagement, guilt,
Hmm.
avoidance of social networks, inability to listen, and there's a whole list. And so that's how it might manipulate in our colleagues is that after they absorb this information, they haven't been able to reset their valve and they're starting to feel a certain kind of way. And until we nurture that, it just kind of stays dormant.
Yeah, that I can even more clearly understand this pendulum you're talking about because a lot of the indicators you mentioned sound a lot like burnout
Correct.
indicators. And so as you're moving further, if this is not addressed,
Hmm.
it then turns into burnout, right?
Correct. Yes.
Yeah.
And there's numerous ways that we can nurture our vicarious trauma because we are in the United States in particular already susceptible to three triggers of vicarious trauma by noon, whether
Hmm.
it's our social media, our email exchange, the news, or even driving to work.
Hmm.
So a lot of us who are in the helping professions, and you got to keep in mind the other helping professions have been researched at nauseum regarding their vicarious trauma. So you've got the medical profession, you've got law enforcement, social services, clergy. These are all practitioners that know that part of their job is hearing other people's trauma, and you can't just shake it off. That's not
Right.
how this works. So we're learning through them, and we're talking more about it because we understand the value of that.
Yeah. 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 And I would suspect that psychologists are another group and they are aware of this. But in student affairs, we haven't talked about this a lot. We might say, "Hey, how you doing? You had to deal with that really tough situation, but it's pretty short-lived."
Yes, I agree. We do more tabletops on the policies to prevent liabilities and litigations, right? And we don't we've done a lot of like circling around of like how did that incident go?
Hmm.
Best practices, but not putting the practitioners involved and said, and now how do you feel?
Right. Not front and center. And not only
Correct.
how do you feel, but what do we do next? And let's get to some what do you do next in a few minutes.
Yeah.
But I first want to go back. You've been doing workshops about this. You've been talking to individuals and
Mhm.
groups. What are
Yes.
the themes that have emerged from your workshops across functional areas in student affairs?
Yeah, I think that validation is really big. Practitioners love to hear, wow, you just validated how I've been feeling.
Yeah.
And it's normalizing the language and not making them feel like they're less than or not a good
Hmm.
employee. I always talk to students in student affairs of you don't get a special cord at graduation because you did it the hard way,
Right,
right?
right.
And I like to use that language with our colleagues of you're doing things super hard. Your performance evaluations are not showing any issues, but yet you have this bias of you feeling weak or not good enough if you disclose that this stuck with you. And
Hmm.
that's what we need to change, right? I'm seeing that theme a lot. I'm also seeing a theme of grit and resiliency and not enough acknowledgement of that's a moment in time. You
Hmm.
could still have grit and resiliency and still acknowledge your vicarious trauma.
Right, right. Yeah, I think people miss that. I'm either resilient and
Hmm.
I can continue to function, well,
Yeah.
or I'm not.
Yeah.
And I'm sort of a mess, right? But the
Right.
reality is both of those could be true at the same time.
100%.
Yeah, yeah. Um, So why has student affairs, if
Mhm.
clergy have done it, if medical field has done it, if law enforcement has done it, if the mental health field has done it, why has student affairs had such a tough time? Why has student affairs struggled to name and respond to vicarious trauma, particularly in the practitioners and
Mhm.
administrators who work in this field?
So I have two theories on that. The first one is that if you go back to educators in general, um, there wasn't a lot of focus on the social work part of our job,
Mhm,
right? So there was some nuances of, I'm thinking about like a dorm mom years ago, right? They would teach you how to iron, they would
mhm,
teach poise and etiquette. And at some point, higher ed evolved to these are life skills and that belongs here, and here's other skills. But in general, I don't think educators ever got the credit of the learning that occurs outside of the classroom.
mhm,
And so in that, it created relationships where students then started sharing more and treating educators, guidance counselors, principals, teachers, and then stemming up to us in higher ed that this is someone that I feel safe that I can disclose what is going on, why I'm not retaining this information, why I can't focus is because I'm hungry. I'm hungry because I don't have money for food, and so on and so forth. So I think it was a shift in education. I also think that some institutions just don't have time to invest in the practitioner. And I
sure.
know that that's a really sad statement that I said, but I do think that some institutions work like a business and it slows down the process if you invest in the people. Now, we've seen corporations invest in the people who have been very successful, but there needs to be from a top perspective of like, what is that investment going to look like so that we get the most out of our employees?
Sure. Well, let's go back to this historical approach. Once
Yeah.
we moved into this professionalism of student affairs, we often saw it go into three different camps. There were the student affairs programs that were housed in counseling programs. So they were doing
Right.
a lot of counseling. There were student affairs programs that were housed in ed
Hmm.
roles, and so educational administration. And so they had a little less counseling, but even those programs had at least one class in
Right.
listening skills or counseling, so to speak. And then there were the standalone student affairs programs, which seemed to take both approaches. And so again, we're talking history, but I think the point you're making is that most of our focus was on um, the helping skills for others. We were focused on the student
Yes.
or the client, and we weren't focused on the individuals doing the work. And we were looking for people who were real skilled. And as the profession, the word has become, accountability.
Hmm.
Not just responsibility, but accountability. And we started getting, paying more attention to, as you were saying, the legal ramifications of the things that we do,
Hmm.
and the potential liabilities, as opposed to um, finding the ways to care both for the student and the helper and the student affairs
Correct.
professional. And so we are sort of stuck there and we're not doing that part of it very well. And in fact, I keep hearing, like, gosh, wasn't COVID the perfect example of that?
Hmm.
We were asking people to go to, especially frontline student affairs people, you're the ones that need to take care of the students that are still here. You're the ones that need to be on delivering the food or whatever.
100%. We
Wow.
learned so much from COVID, and yet some systems haven't changed.
Yeah.
You would be surprised to know when I've done these workshops for other sectors, like the social work, there is a tool that I love to use. It's the Dr. Stam, STAMM. Dr. Sam has a tool, professional quality of life scale, and it's 30 questions, and it was made for the social work program.
Hmm.
Social workers need to take the ProQuil in order to go back into service. Like, so when you think about social workers that were brought in for hurricanes and other natural disasters, they do their ProQuil in order to get back into work. So many social workers that I've met have never even heard of the ProQuil. So
Mm.
how would I expect higher ed practitioners to know about it if the own people that are supposed to be taking it aren't doing it?
Right, right. Yeah, I can think of a variety of situations on a campus where there's been a major event
Hmm.
or and we can define major in some of the same ways that you did. Like we think about 9/11, we think of COVID, we think about a few other things. And afterwards, we might grab everybody in one meeting and just say, "So how are you doing? Let's talk
Mhm.
about this. Anyone that needs to talk about this, let's have it." But it usually ends at that one meeting. We put people together. We're certainly not using a tool like you were talking about, the
Right.
Dr. Stam tool or whatever. But um, but we haven't seen this as sustained. And so
Right.
I'm really, I want to spend some time talking about looking ahead solutions. What can we do? But first, I want to say I want to make sure we understand this one little piece. I've learned from your work that we can trigger vicarious trauma in a way that might seem innocuous.
Yeah.
Like we're interviewing someone, someone is leaving a position looking to get a promotion or going to a new institution. And so we can trigger this vicarious trauma in a way that might seem innocuous to most of us, like a simple interview question. Can you give me an example of how that might happen, an example or two, and then
Yeah.
examples of how we can reframe those same interview questions to avoid um, re-traumatizing the staff who are dealing with that.
Yeah, the one that comes to mind is this question of, can you tell me of a time when you've had to deal with a difficult situation and how you navigated that?
Hmm.
I've been asked that on an interview, and I've had to politely say, I think what you're trying to assess is my ability to crisis manage. Am I hearing that correctly? Because if so, I can give different examples, but I don't really feel that it would be beneficial for everyone to hear the last time or the biggest event that I had to triage, because essentially that's just unloading undue trauma to you.
Hmm.
That's like the major example that comes to mind.
Well, let me stop
Because
with that.
those skills, yeah,
Let me ask you a question about that. What is that question doing? In your answer, it sounded like you were preventing the people in the room that, if it was a group interview, the people who were interviewing you from hearing your trauma, but it
exactly.
doesn't seem to address how it might bring that back up for you.
Right, because I don't think it's fair that I'm interviewing for a job that I want. So I'm
Mhm.
like wearing my best clothes, I'm putting my best foot forward, and now you're asking me to go back and have a flashback
Right,
of a really traumatic situation, and then that's not healthy for me, and now I'm off my game to interview, right? And
right,
so are we purposely sabotaging to see how they do in those spaces because that seems a little dark to me? Or are we asking the wrong question, which is, how do you work under pressure? Can you follow protocols? Tell me about any difficulty that you have with listening to authority, or, those kinds of things are more an appropriate question than reliving one of the worst days of your life in the field, right?
right,
We wouldn't do that to others. We wouldn't do that to military. We wouldn't ask a doctor, tell me about a time that you lost a patient and how it shaped you,
right,
right? I mean,
right.
that is just a bad practice. So I would equate that as my example for that.
Oh, that's great. How else might it come up in an innocuous way outside of an interview? Can you?
Yeah, well, so the other example that I think about is like trauma sharing. So let's say you and I are on the same staff team
Mhm.
and you and I dealt with the same incident, and then we go out to lunch and then we're talking about the incident and we're talking about the nuances of it. That's actually not helpful to either
Mhm.
one of us because that is not what we refer to as a protective factor because we were both in it. That's
Mhm.
essentially just refestering. Now, there's time to case manage, and that's at work, and that's, a deep dive to look at the critiques. But if friends develop at work and then they talk about the same incident, that's just trauma sharing.
Right. And that's not healthy for
Right.
someone experiencing vicarious trauma. How
Right.
about me if I'm not experiencing vicarious trauma, but I still want to, I still can't get this out of my head. I just feel a need to talk about this with a colleague who is. Is that so? If neither of us are feeling vicarious trauma, is that still problematic? I guess is my
Yes.
question.
I would argue that if, so I'll quote Dr. Bridge, who, when I was doing my dissertation, she said to me, the reality is The only individuals that have vicarious trauma are individuals who care.
Mm.
If you don't care about your client, your student, your anyone, then you don't get vicarious trauma. So if I have a student affairs professional saying to me that they don't get vicarious trauma, I challenge, well, you're also telling me you care about our clients and our students. So how does that work? Right? Like you can't be both. You can't say you care about them, you're emotionally invested in them, but that you don't get vicarious trauma because it is an organic byproduct of our job. How you measure your vicarious trauma might be so small compared to somebody else who's very large, but there
Mhm.
is always a level of vicarious trauma.
Okay, so I thought we had talked about in the beginning that not everyone is going to experience vicarious trauma.
Right.
Um,
If they're in the
but
helping profession, but they don't deal with student facing cases, then they wouldn't, right?
right,
Because what if you're working as the registrar? You're in higher ed, so that is a helping profession. But do students really come to you and tell you their grievances or their trauma stories? I don't know. But I can say that I've had registrars who do are on the front
sure,
lines and say, I just heard, this financial aid office, they do their SAP appeals. There's tons of disclosures in those, right? So
right.
it's really about your position and how much exposure you have to the firsthand knowledge of the trauma.
So it's going back to your analogy about the dentist and
Yeah,
brushing teeth in the cavity,
right.
that the same stuff is coming in.
Yes.
And I'm brushing it, I'm brushing well, and the same um, I'm going to get stuck in the analogy because I don't know enough about how a cavity forms, but the same stuff that allows a
Yeah.
cavity to form is
Mm-hmm.
hitting all of us.
Correct.
But because of things I may be doing internally, I
Yes.
can prevent the cavity.
You got it. And there's other things that behaviors that can put protections against your cavity, right? And so
Right.
one of the protective factors is having a good sounding board. And so I always say you vent 3 times to 3 different people and then you move on. And if
Hmm.
you don't feel like you can move on, like you still feel this knee-jerk reaction to tell the narrative again, you probably vented to the wrong people. So I don't like us to vent to family members. They seem to be
Hmm.
biased. I don't know if you know that, but nothing that I do would ever make my siblings say that I'm the worst, right?
Right,
Um,
right.
so a mentor is the best person to vent to because that's someone that you can vent up to. They've typically been where you have been or have some relation and could really be a listener. The second person would be, of course, a therapist because they're paid to listen to you. And then the third would be a partner, someone that is emotionally invested in you for love, and not necessarily someone that does what you do for a living. Because the
Hmm.
other thing is, you can't give someone vicarious trauma.
So if I have it, I can't hand it off to you instead.
Not typically, because you're not going to talk to me about the same students that I'm emotionally invested in.
Got
And
it.
so think about if you're my partner, you're invested in me and my well-being, not my students.
Got it.
So it's a ripple effect. There's this analogy that's very well known in vicarious trauma world where the stone goes into the water and there's a small ripple effect around that. That's going to be the PTSD.
Hmm.
Post-traumatic stress disorder is for the person who experienced the trauma.
Got
The
it.
second ripple is much bigger from this initial impact, and that's us. That's the vicarious trauma. The third ripple is so far removed from the stone that there's no correlation. That's who we vent to, our support
Right.
network.
So they're hearing the sad story or the terrible story or the event, but
Hmm.
they're not affected by it in the same way. And then they're not seeing that person's pain or
Correct.
experience or the event itself. Okay.
Right. And
Yeah,
I
I
mean,
get
I
that.
don't know about you, but when I tell the stories, I don't go into the weeds of all the details, right?
Right.
Like I say, a student was assaulted or, there was a physical interaction. I don't go into the details the way we know them.
Right. Right. Yeah, they're not our details to share, and they're
Right.
not we're not experiencing the details in the same way.
Yeah.
Okay. Yeah, that makes sense. So what are your top strategies for
Yeah.
managing vicarious trauma? Since we're all experiencing this is okay, heads up, everybody, heads up,
Right.
listeners. This is what we need to know. What are those top
So
strategies?
I always get asked what mine are, but then I'm also going to give you three that are pretty well known. Okay.
Sure.
So my strategies are I always wash my hands after a really hard intake. So whether it's discrimination, harassment, whatever the disclosure is, I always go and wash my hands. There's so much research out there about water therapy. It's kind of my way of like getting that ick out.
Sure. Hmm.
I also think of it as like when you're helping someone who was bitten by a snake and there's venom in their body and you suck the venom out, you can't swallow it. You need to get
Hmm.
rid of it yourself. So that washing is like my ritual. I then use different types of lotions to connect to my sensories, and then I go for my walk.
Hmm.
I have a drawer in my office called Happies, and it's like every card or note that I've ever gotten from anyone ever in my career. And I pick one out at random and I read it to kind of reframe myself of like, there are people I have been able to help.
Hmm.
And those are kind of my strategies. Other strategies that can help in reducing the impact of your vicarious trauma can be everyone from like those venting 3 times mentor person that cares about you emotionally, as well as a therapist.
Hmm.
But also, getting a mentee is proven to reduce your burnout and increase your compassion satisfaction. So, think about the last time that you talked to somebody who wanted to be you. There are people who want to be in our field, believe it or not, as crazy
Hmm.
it is they look up to you and they want to hear about it. So, when you do that, you essentially fall in love with your position all over again.
Hmm.
And so I think when we don't spend the time to nurture mentees, and trust me, I know that we're super busy, but in doing that, it is a bit of selfishness. It is some self-care in there because you reminisce on what works well, why you got into the field, and you only tell them the good stuff.
Hmm.
Mentees don't typically hear the bad stuff we're going through. So that's a real way for us to remember and fall in love.
Yeah, that is such a smart thing that I hadn't thought about in a long time. Yeah.
Yeah, I mean, and it's a commitment, right? Just like this is my self-care, I'm going to the gym, right? So you
Hmm.
have to do that same commitment to take care of your vicarious trauma. I also talk about the difference between group care and self-care. So group care is your supervisor's responsibility, and
Hmm.
you as a supervisor are responsible for group care. Group care would look like I am not scheduling staff meetings on Fridays or during lunch.
Hmm.
Self care is the practitioner's responsibility. And I choose to do whatever I need with my lunch hour. And my supervisor prevents any, conflict of interest. That way it pulls me away from what I'm doing for my self care.
Right. Right.
So
Yeah,
those
that
are
makes a
some
lot of
tips.
sense.
Yeah.
I think those are really important because I think we sometimes forget
Mhm.
that as a supervisor, we have some options. We don't have to, we always have a meeting on Tuesday at 10, for example, but
Right.
we just went through something major on
Mhm.
Monday, and it would be real convenient to get everybody together at Tuesday and 10, but it might also be really compassionate to say, we're not meeting this Tuesday.
Yeah. I mean, another things, I don't know if you've ever had this experience. I always find it to be a little bit of a slap in the face when I'm on a call that ends like 5 minutes early and whoever was running the call says, "Oh, I'm going to give you back your time now." And I'm like, 5 minutes? Like, is that a joke?
Right.
I think that's a bad practice. But what I do love is a practice of I'm going to schedule the meeting for an hour. If we get done early, you do whatever you want with it because it's your time, right?
Hmm.
I think it's a different framework. I also love when organizations come together outside of work. I just wish that our field would stop referring it as happy hour and start referring it as social hour.
Hmm.
Social hour helps to nurture those that are in recovery and to stay sober, but it
Hmm.
also helps those extroverts and introverts to be very clear of this is going to require me to be social.
Right.
So
Right.
some stuff like that is really like low-hanging fruit that we can do to help.
Yeah, what are some other institutional shifts that we could do to better support staff?
Oh, well, if I had a magic wand, it would be two big things I've always wanted for our field. One, this idea of how you survive and thrive in the profession needs to be part of the curriculum that we're teaching in higher ed.
Hmm.
If you are getting your degree in higher ed, I want this to be a class, like a part
Hmm.
of the curriculum, just like everything else that we teach. And then my second big ask is that when we do have instances of high trauma, whether it's a Title IX incident or anything that requires the colleague, the staff member to give more than like an hour of work time, that we have a best practice established already. I don't want my staff to have to request time off when they've been up all night. But I know that that would be a huge shift, not just for institutions, but for higher ed. That if we did what like law enforcements do, right? Like, so if you shoot your gun, you're out of work for 3 days,
Hmm.
given. If you lose a child in ER, you get a certain amount, 3 days on, 3 days off. Like there's tons of best practices that other helping professions do to prevent us from overworking, because again, that's where mistakes can happen.
Sure.
But we're just not there yet.
And not only prevents mistakes from happening, but it keeps us further away from the other end of the pendulum that you talked
Correct.
about. We keep going in that direction. We end up in
Yeah.
burnout, which
Right.
there isn't a lot of recovery from, and staying in the field because so many people think that's the end. I need to leave.
Right.
I
And
remember.
that's why I love to talk to colleagues who feel like they're burnt out. And I'm like, well, let's do some assessment. Let's ask, because majority of the time it's just their situation. They're burnt
Mhm,
out from their situation, but not higher ed. I mean, I know I can't save everyone from leaving higher ed, but I do think that you have to look at what I refer to the shoes that you're wearing.
mhm.
Have you grown out of the shoes? Do you need new shoes? Has your style of shoes changed? Like all of these analogies apply to the institution. And so sometimes we're very quick to say, that's it, I'm leaving, I'm going barefoot forever. And it's like, okay, well, let's just take a beat here and be creative with your network to talk about it.
Right, right. It's so funny how we make these quick assessments. I remember when I was first I had moved into a different job, and the person who was there, and it was a big, big administrative position, and the person who was there before me was probably 4 feet taller than I was. He was a very tall man. And I'm sitting at the desk that he was at in the chair,
Mhm.
and every day I was going home with a backache.
Oh,
And I kept thinking, God, maybe this is too much stress going through it. My feet didn't touch the floor. This is what I didn't realize. And so I was ready to think I wasn't ready for this position or whatever. And I didn't fit the role. And what didn't fit was the chair. I got a new chair
I love
and I
that.
was fine. And so it's a perfect example of this that we
Hmm.
think this means I no longer belong in the profession, no longer want to do this. I'm tired of doing this. It might mean I need a change in career. It might mean I just
Correct.
need a new pair of shoes, as you said in your
Right.
example.
Yeah.
Yeah.
Vacation time is there, PL time is there, and I think a lot of our colleagues, I know that we're so busy, but even just a 15-minute check-in with someone
Hmm.
could reshift perspective for you for the day, right? And
Right.
so I think being able to give yourself those permissions to say, yeah, I need a break. I'm going to take the break and then I'll reassess.
Right. I think that that's so important, and we don't do it because we think if I can get one more thing done,
Correct.
I really have this report that's due. Well, it is due.
Right.
But 15 minutes isn't going to stop you from getting it done.
Correct.
So what would you say to someone who now realizes after listening to this conversation that they've been experiencing vicarious trauma?
Yeah, I mean, hopefully they can breathe a little bit better and feel not, the solidarity of our job. I also think one of the ahas that a lot of our colleagues have when they're like, wow, this is what I've been experienced, they now have a new love for what they do. So I really, Dr. Figley, when this started coming out in like the 80s, said that there was a cost for caring,
Hmm.
right? Like there's a palpable cost for caring about someone. What I'm trying to reframe in our field specifically is that this is a badge of honor.
Hmm.
I would love all the colleagues who are feeling like they have vicarious trauma to say that I'm so proud of them, because my two toddlers one day might go to higher ed. And when they do, I want them to be surrounded by people who care about them as deeply as I'm caring for my students. And so if we continue to stay invested, you should be proud of the fact that you are so emotionally invested that you do take some of it home with you, and all we need to do is focus on how to reframe that, how to reframe the idea that you are evolving within the job and the things that you're exposed to, no different than any other helping profession.
Right. Yeah. Um, I I'm just so struck by that.
Mm,
that, this cost of caring, that whole phrase that some people say, well, I shouldn't care so much. And you're
mm,
saying, no, that really is um, a strength of you in this profession. All we have to do is figure out ways to
mhm.
help you manage that caring.
Correct. Yes.
Well, Joe, I want to just say thank you for your insights. I am so grateful for your time today. I learned a lot. I had fun with this made me think about a lot of things, and this has been a great conversation. So thank you for being here.
Thank you for having me.
Hey, that's all for today's episode of Student Affairs Now. Thanks to our sponsor, Evolve. Evolve helps senior leaders who value, aspire to, lead on, and want to unleash their potential for transformational leadership. Our own Keith Edwards from Student Affairs Now, along with doctors Brian Araro and Don Lee, offer a personalized experience with high impact value, the asynchronous content and 6 individual and 6 group coaching sessions maximize your learning and growth with a focused time investment, greatly enhancing your ability to lead powerfully for social change. So, listeners, we ask you to check out what Evolve can do for you and for your professional development. Hey, huge shout out to Natalie Ambrosi, the production assistant for the podcast, who does all the behind the scenes works to make us look and sound good. And as you listen today to this episode on vicarious trauma, if you found this content to be useful for your student affairs practice and your scholarship, we'd love it if you share this episode with your social media networks. Subscribe wherever you get your podcasts and follow us online. Share this episode. It might be just what someone else needs to hear. I'm Rochelle Pope. Thanks again to Dr. Jill Bassett-Cameron. If you're feeling seen and heard right now, sort of like Jill just narrated your inner monologue,
Mm.
know that you're not alone. Till next time.